Hello students, welcome to part 2 of the assessment of the musculoskeletal system. We are gonna get deep into assessment. So when we are assessing the musculoskeletal of a patient, we're going to assess for mobility. Limitation is the major cause of physical disability, right? Requiring many individuals to assess ambulatory aids, to use ambulatory aids such as canes and walkers or wheelchairs, especially for middle-aged and older adults. So physically disabled may also have difficulty with one or more functional activities such as bathing, toileting, and dressing. I am explaining all these factors in details because we all have family members that needs to have an assessment of the musculoskeletal. Our first patients are, is our family. Our first patients are with family. Okay, physical disability and social determinants of health. This is good to know. That's good to know. Physical disability occurs most commonly in older adults from Hispanic. That's good to know. American Indian, Alaska Native, and other racial groups when compared to whites. That's good to know. The poverty level, having low levels of education and being unemployed or underemployment when compared with whites are likely responsible for these differences. When taking a personal health history, question the patient about any traumatic injuries and sport activities, no matter when they occur, no matter. An injury to the lumbar spine 30 years ago may have caused a patient's current low back pain and possible disability. A motor vehicle crash or a sport injury can cause osteoarthritis years after the event, okay? And as patients, whether they are following a pain management plan, including the use of substances such as cannabis. So it doesn't matter when this traumatic event occurred, okay? We have children, I know a couple of kids that they love to ride the bicycle in a mountain, right? And then they like to hit big trees. That was the way they were having fun, riding the bike and hit the tree, right? And then they fall and the bicycle goes in other direction. So these kids right now that they are in their 20s, almost their 30th, they are having problems with the cervical spine. So be careful. It doesn't matter when did you get the traumatic event. At any age can cause further problems. Patient with diabetes who is treated for a foot ulcer is a high risk for acute or chronic osteomyelitis. This is another concept. Bone infection. Osteomyelitis is a bone infection. Okay? So in addition, diabetes slows the healing process. So we learned so far osteopenia, osteomyelitis, osteoporosis, osteomyelitis. Okay, so inquire about occupation or work life. We saw that people that are sitting for long periods of times are gonna have any type of kyphosis. Fractures are common in patients whose jobs require manual labor, such as housekeeper, mechanics, and industrial workers. Certain occupations, such as computer-related jobs, may predispose a person to carpal tunnel syndrome, which is the entrapment of the medial nerve in the wrist or neck pain. And I will teach you some techniques to assess for carpal tunnel syndrome. There are certain techniques that are basically taught for family nurse practitioners, but I think you nurses need to know this. I'm gonna do that in class. Allergy to dairy products could lead to decreased calcium intake Some drugs such as steroids can negatively affect calcium metabolism and promote bone loss. Inquire about herbs, vitamins, and mineral supplements or biological compounds that may be used for arthritis and other musculoskeletal conditions such as glucosamine and chondroitin. Many people are taking this nowadays, either separate glucosamine supplements only or combine glucosamine, chondroitin combined, right? I gave you a guide to calcium-rich diet in the supplemental file. You can go over this and see other types of food, vegetables that you can get instead of getting calcium supplement, right? Or maybe if you're having an allergy to dairy products, you can supplement yourself with this nutrients, fruits and vegetables, okay, or maybe certain proteins that are high in calcium. Nutrition history. Okay, we're gonna ask women do not get enough calcium in their diets. We need to assess why they are not getting calcium in their diets. Determine whether the patient has had significant weight gain or loss and whether the weight change was expected. We need to assess for lactose intolerance. It's a common problem that can cause inadequate calcium intake because patients, they don't take any more, they don't get any more milk because of the lactose intolerance. So that's why it's important to review the guide to calcium-rich diet. Inadequate protein or insufficient vitamin C or D in the diet slow bone and tissue healing. So remember your CDC. I know you are going to remember the Center for Disease. No, his CDC means a diet rich in vitamin C, vitamin D, and calcium. Your CDC diet, okay? Your CDC diet. Obesity places excess stress and strain on bones and joints with resulting trauma to joint cartilage. Obesity inhibits mobility in patients with musculoskeletal conditions, which predispose them to complications such as respiratory and circulatory problems. So remember, your fat embolism prognosis is going to be related to the condition of your heart and lungs before the presentation, before fat embolism occurs. And also remember, your obese patients are going to have distended abdomen, which is going to pull the lumbar. When you pull the lumbar, the whole spine is going to be affected, even the cervical. Okay, remember that. People with eating disorders such as anorexia nervosa and bulimia nervosa are also at risk for osteoporosis because they are not getting the proper nutrients related to decreased intake of calcium and vitamin D. And family history, identify disorders that have a familiar or genetic tendency, for example, osteoporosis and gout, a genetically linked arthritis caused by an inborn error of purine metabolism, often occur in several generations of a family. Let me play a video about osteoporosis. Okay, here we go.
The skeleton is made up of bones, which provide support and shape to the body. They protect soft internal organs, such as the brain and heart, from injury. Together with muscles, strong bones enable the body to move freely. Bones have a solid outer surface called compact bone. The inner bone is called spongy bone because it is less dense than compact bone, and has many small holes like a sponge. Bones contain cells called osteoclasts that break down bone tissue. Other cells, called osteoblasts, make new bone tissue using minerals such as calcium and phosphate from the blood. Hormones such as estrogen, growth hormone, and testosterone help keep the number and activity of osteoblasts higher than osteoclasts so that more bone is made than removed. Physical forces and pressure during exercise also help bones to grow stronger and denser. These processes allow bones to grow strong in children and young adults. People have their strongest, most dense bones, called peak bone mass, in their 30s. After this age, osteoclasts gradually remove more bone than the osteoblasts make. Osteoporosis is a condition that leads to weakened bones, causing them to break more easily. Healthy bone is dense enough to support and protect the body, and to handle the stresses of movement and minor injuries. However, people with osteoporosis have abnormally thin bones with larger holes in the spongy bone. There are two types of osteoporosis. Primary osteoporosis is usually related to older age, as well as a reduced amount of estrogen in women. Secondary osteoporosis affects both children and adults. It is related to other diseases or conditions, such as cancer, hormone problems, or use of certain medications. A person has a greater risk for either type of osteoporosis if they don't develop enough bone mass when they're growing from childhood to adulthood. Risk factors that can lead to low peak bone mass include a family history of osteoporosis, being white or Asian, being female, a poor diet, certain medications such as steroids or certain seizure medicines, lack of physical activity and weight-bearing exercise, and lifestyle behaviors such as smoking and drinking too much alcohol. A person also has a greater risk for either type of osteoporosis if they have an abnormal amount of bone loss after age 30. Some bone loss is normal after this age. However, a person with the same risk factors for low peak bone mass can be more likely to get osteoporosis as they age. Increased bone loss is also common in women after the time of a woman's last period, called menopause. After menopause, a woman's ovaries stop making the hormone estrogen. With the drop in hormones, bone-removing cells, called osteoclasts, are more active than the bone-making cells, called osteoblasts. Bones may break or fracture easily because they're unable to withstand the physical strain and pressure from even normal activities. Common fracture locations in people with osteoporosis include the wrists, spine, and hips. Building strong, healthy bones through a diet rich in calcium and vitamins and getting regular exercise can help prevent as well as treat osteoporosis. Common medications for osteoporosis include biphosphonates, a medication called denosumab, selective estrogen receptor modulators or SERMs, and calcitonin. In general, these medications act on bone-removing cells called osteoclasts. Parathyroid hormone acts on bone-making cells called osteoblasts. Food or supplements containing calcium and vitamin D are also recommended for osteoporosis. For more information, talk to a healthcare professional.
Thank you so much. It was a good review, and a review is it's not too much. It's always good a review, right? Certainly, this review have been a summary of what we discussed on the first part. So remember, okay, I want to make a parenthesis here. This is a parenthesis, okay? The ovaries are the one producing estrogen until the woman gets menopause. Okay, probably you are studying this right now in your OBGYN. But an increased amount of breast cancer are being developed in women post-menopause. And these breast cancers are related to estrogen. Professor, how come after menopause, a huge amount of women are getting breast cancer related to estrogen? Because after menopause, the one that is creating estrogen is the fat tissue cells. So all the people that are obese and they are having increased abdomen after menopause, okay, those cells in the abdomen or in the arms or anyway in the thighs, those are the ones creating the estrogen. That is a butt type of estrogen, and those women are in risk to develop breast cancer. Okay, this was a parenthesis. So there is the good estrogen, the one produced by the ovaries, and there is the bad estrogen, the one produced by the fatty cells, the fatty tissue post menopause. Okay, let's go back to this. That's to make a clarification, okay? Because I'm probably somebody in menopause having breast cancer due to estrogen, and you're going to say, how come the ovary is not producing any more estrogen? How come this person in after menopause is developing breast cancer? Okay, so we saw the osteoporosis, and now we are going to watch the video related to gout, which is another genetic risk for developing these bone issues.
Gout is an arthritic disease of your joints caused by too much uric acid in your body. Normally, your liver processes various substances in your body, including purines, which are components of genetic material found both inside your cells and in some foods you eat. When your liver breaks down purines, a waste product called uric acid is produced. Your body disposes of this waste through your kidneys, which remove it from your blood. When your liver produces too much uric acid, or your kidneys do not remove enough of it from your body, excess uric acid accumulates in your blood, resulting in a condition called hyperuricemia. Caffeinated beverages affect the waste removal function of your kidneys by increasing your urine output, which eliminates too much water from your body, a condition called dehydration. Dehydration can result in a higher concentration of uric acid in your body's fluids. When the concentration of uric acid becomes too high from any of these sources, it can no longer stay dissolved. The excess uric acid begins to form needle-like crystals inside your joints, most commonly in your big toe. Formation of uric acid crystals leads to an inflammatory response. White blood cells from your immune system attack the uric acid crystals, resulting in joint pain and inflammation. This is called an acute gout attack. If left untreated, elevated uric acid levels may result in lumpy deposits of uric acid around your joint, called a tophus, causing additional joint pain and disfigurement. Treatment for acute gout attacks includes colchicine to prevent or reduce joint inflammation, non-steroidal anti-inflammatory drugs to reduce pain and inflammation, including aspirin, ibuprofen, such as Advil, Motrin, and Nuprin, naproxen, such as Aleve and Naprosyn, and steroid drugs, such as prednisone. Treatment for chronic gout includes drugs that promote uric acid excretion and drugs that inhibit uric acid production by your body. Lifestyle changes to prevent recurrent or chronic gout include reducing red meat and shellfish in your diet, limiting the consumption of alcohol, which is high in purines, limiting caffeinated beverages, exercising regularly, and drinking plenty of water.
Thank you so much. So when you come across the blood work of a patient and you see there is an elevation in the liver enzyme, your AST, ALT, your alkaline phosphate, and the uric acid is getting borderline high, that is the moment to conduct patient education. You need to go and first assess, what are you eating? Are you eating a lot of red meat? Are you getting a lot of alcohol, coffee, shellfish? Okay. And you are going to educate the patient about this. You need to educate in order to prevent. And remember that the purine is also found in liver, we know that, shellfish, alcohol, and they can also be formed in the body when DNA is broken down. So that is why this is the genetic risk with gout. Okay, think about it. That's something that is good to know. You need to know, and you need to master these concepts and patient education. Current health problems, you're going to check for pain, chronic pain or weakness. And also you're going to use your all cards mnemonic in order to assess the onset, the location, duration, characteristic, blah, 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 whatever appears here. NCLEX examination challenge. The nurse is assessing a newly admitted client. Which of the following findings would be a concern to the nurse regarding the client's risk for musculoskeletal health condition? Okay, first trick to answer questions in an exam and in NCLEX. First trick, start with the question. Start with the question of the question. Meaning, I have here the question in front of me. I'm going to look for which of the following findings. I'm going to start with that. Which of the following findings would the nurse would be of concern to the nurse regarding the client risk for musculoskeletal health condition? This is what I'm looking for, the risk for musculoskeletal conditions. Okay, now I'm going to the question. The nurse is assessing a newly admitted client. So for that newly admitted client, she's gonna look for the factors that are the risk for musculoskeletal conditions. Okay? A, older adult over 80 years of age, yes, because it's a change due to the age. History of osteoporosis, of course. History of wrist fracture 50 years ago. Remember, the traumatic event it doesn't matter when it happens. So this is another risk for musculoskeletal health condition. Was in a minor motor vehicle accident 10 years ago. It's a risk too. It's a minor, okay? You can be driving your car and somebody's hitting you in the back, and that is making you move your cervical very strong forward and backwards. However, at that moment you didn't develop any condition, but with the years, right, it's gonna cause a disease. Lactose intolerant, yes, you are not getting your daily products. So all of them are a risk for musculoskeletal health condition. And this question is good to know. Is your select all that apply? The age, osteoporosis, the history, that's good to know. It's coming. History of wrist fracture 50 years ago, was a minor motor vehicle accident, lactose intolerance, okay? Pain can be related to bone, muscle, or joint problems. Pain with movement could indicate a fracture and or muscle or joint injury. Assess the intensity by using a pain scale. Quality of pain may be described as dull, burning, aching, or stabbing. Determine the location. So the mnemonics is going to help you with that. Weakness may be related to individual muscles or muscle groups. Determine whether weakness occurs in proximal or distal muscles or muscle groups. Proximal weakness near the trunk of the body may indicate myopathy, a problem with muscle tissue. So proximal weakness. Distal weakness and impaired sensory perception, especially in lower extremity, may indicate neuropathy, a problem with nerve tissue, your diabetic patients. Muscle weakness in the lower extremities may indicate the risk for fall and injury. Weakness in the upper extremities may interfere with mobility and functional ability. Assessment of the musculoskeletal. For physical assessment of the musculoskeletal, use inspection, palpation, and range of motion. Observe the patient posture, gait, and general mobility for gross deformities and disabilities. Posture indicates the person's body build and alignment when standing and walking. Assess the curvature, for me this is the most important, of the spine and length, shape, and symmetry of extremities. Lordosis. You have here the inward abnormal curvature of the lumbar spine. It's a common finding in adults who have abdominal obesity, the one that I was talking before, lordosis. You see here, the abdomen is going to pull the lumbar. You have the scoliosis, it's kind of a S in the spine, and then kyphosis is the movement of the cervical to the front, right? These are the three that you need to assess. If the extremities are affected by a muscular condition, assess arms or legs at the same time for side-to-side comparisons. For example, inspect and palpate both arms and shoulders for deformity, poor alignment, tenderness of pain, and mobility. If the hands are affected, inspect and palpate the metacarpophalangeal, proximal interphalangeal, and distal interphalangeal joints. The same digits are compared on right and left hands. Always the assessment has to be bilateral. Determine the range of motion for each joint by observing active movement. If movement is not possible, evaluate passive motion. For a quick and easy assessment of range of motion, ask the patient to make a fist and then oppose his finger to the thumb. If the patient can perform these maneuvers, range of motion of the hand is not seriously restricted. During the assessment of the skeletal area, note the size, shape, tone, and strength of major skeletal muscles. Ask the patient to demonstrate muscle strength. Also apply resistance by holding the extremity and asking the patient to move against resistance. Okay, so you have the image here. Mobility and functional assessment. Assess the patient need for ambulatory devices such as cane, walkers, transfer from bed to chair and while walking. Observe the patient's ability to perform ADL such as dressing and bathing, because I would say also dressing and bathing is going to give you a good diagnosis, right? It will give you an idea of these patients are going to be able to perform ADLs related to cooking, okay? If they are not able to do this, they are not having proper nutrition. Okay, the patient with hip joint pain usually experiences it in the groin or has pain that radiates to the knee or lower back. That's why the old cards mnemonic is very good, because it's asking you, the onset, location, duration, characteristic, what are the alleviating, relieving factors, where it radiates, okay? The knee is rarely accessible for physical assessment, particularly when the patient is sitting and the knee is flexed. Fluid accumulation or effusion is easily detected in the knee joint. The knees may be poorly aligned, as in genu valgum, knock-knee, or genu varum, the bow-leg deformities. And that's good to know. Those two are good to know. And this is a good video to help you remind the difference. And it's going to give you a mnemonic to remember the genu valgum versus the genu varum. Okay, let's watch 1 minute video.
In the first block of anatomy classes, you'll learn how to describe the human anatomy from proximal to distal, ventral to dorsal, and later apply varus and valgus stress tests to the extremities. Or was it valgus and varus? What's valgus again and which one was varus? To end the confusion, we'll cover a handy mnemonic on today's episode of Mnemonic Monday. Okay, so let's think of gum and how gum can stick on the desks or stick things together. So if we take the knees and we want to know which position is valgus and which one's varus, we take that gum and stick the knees together because valgum makes the knees stick together. So in the valgus position, the knees go together, and in the varus, well, varus is the other one. Okay, that was this week's mnemonic. If you liked it, give it a thumbs up and subscribe for more. Check the links in the video description. And as always, thanks for watching. I'll see you next week. Bye.
Thank you, that was great. These two videos of the musculoskeletal are full of mnemonics. Okay, you have the timu-bo, which is tendon, bones, and muscles. You have the boli-bo, bones, ligaments, and bones. You have the osteoclast, where C representing the cut of the cells, the breakdown, the metabolism of the cells, and the osteoblast, where the B represents the birth of new cells. And that's the way you should study. Here you have the genu valgum, which is the knock-knee, so remember the gum, and the genu varum is going to be the other one. So it's easy to remember. Neurovascular assessment, this is a very, very, very important part. Perform a complete neurovascular assessment, also called a circ check, which includes palpation of pulses in the extremity below the level of injury and assessment of sensation, movement, color, temperature, capillary refill, and pain in the injured part. If pulses are not palpable, use a Doppler to find pulses in the extremities. Psychosocial assessment, prolonged absence from employment or permanent physical disability may cause job or career loss. In case of chronic pain, this will have worse consequences because patients are going to be affected in their self-esteem. Deformities resulting from musculoskeletal disease or injuries such as amputation can affect a person's job images and self-concept. Yes. So another mnemonic that I just remember is the calcitonic, calcium to non-increased levels, calcitonin, and PTH, the parathyroid hormone, which is put that calcium. Okay, so it's a full of mnemonics, these two videos. Diagnosis assessment, the common laboratory tests used in assessing patients with musculoskeletal disorders are outlined below. And that's why many students, they don't want, they believe, they feel that the musculoskeletal and the nervous system are two concepts, two chapters that are so confused and tedious to study. And it's not. If you get the right mnemonics, it's gonna be fun. Okay, disorders of bone and the parathyroid gland are often reflected in an alteration of the serum calcium or phosphorus levels. Disorders of bone and the parathyroid gland are often reflected in an alteration of the serum calcium or phosphorus level. Okay, because we know the relation between the bone and the parathyroid, between the bone and calcitonin. Therefore, these electrolytes, especially calcium, are monitored. A decrease in calcium in serum calcium could indicate bone density loss. Alkaline phosphatase, ALP, is an enzyme normally present in blood. The concentration of ALP increases with bone or liver damage because this enzyme is one of the three that represents the liver. You know, your AST, your ALT, and your ALP. In metabolic bone disease and bone cancer, the enzyme concentration rises in proportion to the osteoblastic activity, which indicates bone formation, right? Because if there is bone cancer, that means that the osteoclast, the one that is cutting, is overworking, but the production of the osteoblast is going to increase to balance the osteoclast activity. The level of ALP is normally slightly increased in older adults. Okay, so here we have the laboratory profile musculoskeletal assessment. Your serum calcium is going to be from 9 to 10.5. 4, 5, 6, 7. Okay, 9 to 10.5 is going to be hypercalcemia when metastatic cancer of the bone. So this cancer is going to cause the destruction of the bone, and the bone is going to be released in the blood, in the serum. That's why the calcium is going to increase. This is happening also in Paget disease, in bone fracture, in healing stage, right? The hypocalcemia, and this is good to know, increased calcium in bones fracture. Okay, hypercalcemia, increased calcium in bone fracture. Hypocalcemia, decreased calcium, is going to appear in osteoporosis and osteomalacia. Okay, that's good to know. Hypocalcemia related to osteoporosis and osteopenia, and normal age related decrease in calcium. Serum phosphorus 3 to 4.5 in hyperphosphatemia related to bone fractures in healing stage and bone tumors. In hypophosphatemia, decreased phosphorus, osteomalacia. Practice and try to understand these concepts. Try to master these concepts, okay? So whenever you come across a question that is going to give you levels, okay, of phosphorus or calcium, you know already what conditions are related to those levels. Here comes the alkaline phosphatase, 30 to 120, 30 to 120, metastatic cancer of the bone or liver, also serum muscle enzymes like creatinine kinase. This is very important also. This is very important. It's going to give you an idea of muscular dystrophy, okay? And you have to consider this one as well. And also lactase dehydrogenase. The levels are 100 to 190. The elevations are related to skeletal muscle necrosis, which is the cell death, but also it's going to give you an idea of extensive cancer, so cancer of the bones. So having said that, cancer of the bone, I want you to think about lactate dehydrogenase in leukemia, right? If we are having cancer of the bone, we are having, of course, cancer in the marrow, and leukemia is going to be representing that. Sometimes patients are going to have the LDH very elevated in leukemia without having bone cancer. I've seen patients with a LDH levels of 1500 in leukemia patients. Okay, so think about that. Aspartate aminotransferase and aldolase ALD. The major muscle enzymes affected in skeletal muscle disease or injuries are creatinine kinase, lactate dehydrogenase, which is your LDH, aspartame aminotransferase, AST, and aldolase. Okay, remember these 4. That's good to know. Muscular atrophy causes elevation in muscle enzymes, creatinine kinase, lactate dehydrogenase, aspartate aminotransferase, and aldolase. okay? But does not affect minerals like calcium and phosphorus. So you can have elevation in this, but no effects on calcium and phosphorus. Let me put this in other terms. The major muscle enzymes, muscles, are not bones. That's why calcium and phosphorus is not affected. Okay? We are not talking about bones. That's why calcium and phosphorus is not affected. When we talk about muscle enzymes, we are talking about creatinine kinase, lactase dehydrogenase, aspartate aminotransferase, and aldolase. Okay? Okay. Imaging. What imaging are we gonna use? The radiology. The skeleton is very visible on standard X-ray. Bone density, alignment, swelling, and intactness can be seen on X-ray. Size of the joint space, the smoothness or articular cartilage, and synovial swelling. In CT, computed tomography, test is very helpful in detecting musculoskeletal conditions, particularly those of the vertebral column and joints. The nurse or radiology technology should ask the patient about iodine-based contrast allergy if contrast will be used. In other words, if it's going to be a CT with contrast, you ask for iodine-based contrast allergy. Is it going to be a CT without? You don't need to ask. Now, if we're going to use an MRI with or without, the use of contrast media is commonly used to diagnose musculoskeletal disorders. And for MRI, we're going to use gadolinium. Okay. It is more accurate than CT for many spinal and knee problems. MRI is most appropriate for joints and soft tissue, such as muscle, tendons, and ligaments. Magnetic resonance arthrography combines arthrography, contrast medium injection into a joint, and MRI. It is particularly useful for diagnosis problem of the shoulder and the type and degree of rotator cuff tears. Now, if we move to ultrasonography, these are sound waves produce an image of the tissue, and they are gonna be used to check for soft tissue disorders such as masses and fluid accumulation, traumatic joint injuries, osteomyelitis, which is bone infection, and surgical hardware placement. Now, bone scan. The bone scan is a radionuclide test in which radioactive material is injected for viewing the entire skeleton. It is occasionally used to detect bone tumors, arthritis, osteomyelitis, we know, bone infection, osteoporosis, vertebral compression fractures, and unexplained bone pain. The nuclear medicine physician or technician administers the isotope 4 to 6 hours before the scanning, and then after 6 hours, the test will be conducted. Other diagnoses, biopsies. In a bone biopsy, the physician extracts a specimen of the bone tissue for microscopic examination. This invasive test may confirm the presence of infection or neoplasm, but it's not commonly used on today. One or two techniques may be used to retrieve the specimen: needle or biopsy or incisional open biopsy. So action alert, that's good to know. After a bone biopsy, watch for bleeding from the puncture or incision site, for tenderness, redness, hyperpigmentation, or warmth that could indicate infection. Mild analgesics may be used. That's good to know. Check for tenderness, warmth, and incision site at the incision site after a bone biopsy. That's good to know. I said it 3 times. Arthroscopy may be used as a diagnostic test or a surgical procedure. An arthroscope is a fiber optic tube inserted into a joint for direct visualization of the ligament, menisci, and articular surfaces of the joint. The knee and shoulder are most commonly evaluated. In addition, synovial biopsy and surgery to repair traumatic injury can be done through the arthroscope as an ambulatory care or same-day surgical procedure. So the patient must have mobility in the joint before in the joint being examined. Those who cannot move the joint or who have an infected joint are not candidates for the procedure. And that's good to know. Safety, safety, safety. Let me say it again. The patient must have mobility in the joint being examined. This is for arthroscopy. Those who cannot move the joint or who have an infected joint are not candidates for the procedure. Rationale for this. If you're going to insert a fiber optic tube into a joint, and if the patient cannot move, means that there is a neurological problem there. Are you going to insert something to cause further damage in the nerves? No. If the patient is having an infection and you are inserting a fiber optic tube that probably, maybe, who knows, is not sterile, right? Are you going to cause more infection? Yes, that is the rationale. So, for an arthroscopy, the patient must be able to move and must be infection-free. Okay? Safety, safety, safety. That's good to know. You will see this question. If the procedure is done for surgical repair, the patient may have a physical therapy consultation before arthroscopy to learn the exercises that are necessary after the test. And that's good to know as well. So why? Because after the test, the patient should be able to move and to replicate exercises for recovery. Range of motion exercises, that's good to know. Range of motion exercises are also taught, but may not be allowed immediately after arthroscopic surgery. Okay, so the patient needs to visit the physical therapy, a consultation, to learn the exercises that are necessary after the test. The patient is usually given local, light, general, or adult or epidural anesthesia, depending on the purpose of the procedure, right? The arthroscope is inserted through a small incision shortened at a 1/4 inch. Multiple incisions may be required to allow inspection of the variety angle. Okay. Safety, safety, safety. The priority for care after arthroscopy is to assess the neurovascular status. That's why all patients need to have mobility, and you need to be able to assess neurovascular status bilateral, not only in the affected limb per agency or surgery protocol, but bilateral in the long term. Monitor and document distal pulses, warmth, color, capillary refill, pain, movement, and sensation of the extremity affected. And I will strongly suggest to conduct this neurovascular assessment bilaterally. First, you start with the affected extremity, and then you conduct it bilaterally. And then ice is often used for 24 hours, and the extremity should be elevated for 12 to 24 hours. And we're gonna use RICE, right? The protocol RICE: rest, ice, compression, elevation. When arthroscopic surgery is performed, the primary healthcare provider usually prescribes a short-term opioid analgesic combination, such as oxycodone and acetaminophen. Although complications are not common, monitor and teach the patient to observe for swelling, severe joint or limb pain, thrombophlebitis, and infection. Okay. let's watch this video about RICE. These are things that you need to learn and you need to master these therapies, okay?
After an injury, you can relieve pain, reduce swelling, and promote healing with the RICE treatment. Stop using the injured body part as soon as possible and avoid any activity that is painful or may have caused the injury. Apply ice or an ice pack to the injured area for the first 48 to 72 hours following an injury. Use a barrier between the ice and your skin. Apply ice several times a day for 20 minutes at a time, followed by 1 hour off. Wrap the injured body part firmly with an elasticized bandage, compression sleeve, or cloth. This will help speed up healing time by reducing swelling around the injury. Elevate the injured body part above the level of your heart to decrease swelling and joint pain. As with any injury, if it does not start responding within a day or two, or you suspect there may be a more serious injury, seek medical attention.
Thank you so much. This was very clear. And when you put the ice, try to use a little towel between the ice and the skin, because you don't want the skin to burn, okay, because of the ice. Now, and you always have to think about your diabetic patients, okay? They have sensory perception, diminished sensory perception. So if you put ice, you put heat, they don't feel anything, okay, in advanced diabetes patients. Now, teach the patient to immediately contact the primary healthcare provider if these conditions are observed. That's good to know. NCLEX alert. Report swelling, pain, thrombophlebitis, infection immediately. That's good to know. Here, a client who had an arthroscopy surgery for knee ligament repair reports increased swelling and pain 2 days after the procedure. So he's reporting increased swelling and pain 2 days after the procedure. What action would be the best for the nurse to recommend for the client at this time? And you practice your technique that I taught you. You first read the question of the question. What action would be the best for the nurse to recommend? Okay, they're asking me for an action. And then you read the whole stem of the question. Apply ice 4 times a day. Elevate the leg on 2 pillows, notify the surgeon immediately, continue taking analgesia. Okay, so the answer is notify your surgeon immediately. That's good to know. This question is good to know. Okay, so with this, we have finished the chapter related to assessment of the musculoskeletal system. Thank you so much for your attention, and let's continue with this musculoskeletal part of the book. Thank you.